One new sexually transmitted infection is diagnosed every minute in the UK, with 1 in 3 women and 1 in 5 men having a silent STI. Infections such as gonorrhea and chlamydia are much more common than people realise and can cause infertility. Or in pregnant women, infections can be passed on to unborn babies. Brian, there are some shocking statistics regarding STIs. What do you actually test for at Innermost Secrets?
Well, one of the big problems with sexually transmitted infections is that many of them are completely silent. So it's difficult either taking a history from somebody to try and work out what infections might be present. And
so, sorry, by silent you actually mean there are no symptoms?
Absolutely no symptom at all. Somebody who's perfectly fit and well, a woman who doesn't have any discharge, any discomfort, anything at all as a guide or a man, that there might actually be a problem there. And it's one of the reasons why sexually transmitted infections spread so quickly, because people don't know that they're passing it on to others.
So if somebody came to have some tests from you, is it truly confidential? I mean, you say it's confidential. How do you deliver the results?
We have actually pioneered the use of a laboratory technique which now allows you to check a urine sample for most of the common sexually transmitted infections. And one of the big advantages of that is that you can actually now order from us a kit over the internet, provide a urine sample at home and then send that sample to the lab, so it's no longer necessary to actually come to a clinic to see us or the GP or to go to a gum clinic.
So what about HIV or AIDS testing? How would you do that?
One of the problems at the minute is that not all of the sexually transmitted infections can be tested for on urine. And so for hepatitis and syphilis and HIV, you need a blood sample. But we're currently working with the laboratory to actually produce a blood spot test, so that in the future it should be possible for somebody to take a little finger prick of blood and put that on a card and then post that in the same way, which means we'll be able to offer the full range of testing without anybody ever having to come to a clinic.
But at the moment you are still offering the HIV and hepatitis tests via blood tests, but I understand you have to go to your doctor just to have the blood drawn.
Yes, that's right. Patients can either come here or they can take one of the sample kits to a GP or to a private clinic to actually have the sample taken, or if they have a family member or friend who is a nurse, they can actually take that sample for them and again post them off. The other thing which is important is actually getting the results. So the information that goes to the lab is based on a confidential number, so it's not traceable except by us. And when the results go back to the patient, it will go by either a confidential email or, better still, a confidential text message, so that there's no paper trail.
So what happens with any of these infections if the test results are positive?
If any of the results are positive, we have a subspecialist consultant who is an expert in the field of sexual health, and therefore we would offer a confidential meeting with that doctor to discuss what the actual results meant and what treatments and options were available.
And you even offer a counselling service as well?
Yes, because I think that's equally important for all of our services. One of the big components is not just the pure medical health aspect, but is the whole area around the stress and anxiety that something like a positive result can cause. And therefore we have a full range of counselling services and an expert in counselling to support people through that.
So who do you think should be tested?
Well, I think basically anybody who is moving into a new relationship, who has had a previous sexual relationship. Because these infections are silent, there are often no warning signs, and you don't have to sleep around to have picked one of these infections up. So I think anybody who's in a new relationship should have a very responsible conversation and say, look, as a couple, I've had a previous partner, you've had a previous partner, we intend to only be with each other, but we should both get screened. If we need to get treated, then we can do that. And provided we then have a monogamous relationship, it's not something that we have to address in the future. But at least we're not bringing into that new relationship a sexually transmitted infection from the past.
Would you actually consider having the test in a relationship yourself?
Yes. I mean, I've had a previous partner. If I was in a new relationship, I think you owe that as a sense of responsibility to your new partner.